Dr. Barry, licensed psychologist, and here we talk about psychology and true crime. Thank you for joining me. If y'all have heard the intro before, StreamYard changed the music on this intro, and I like the change. It's all right. But today we are going to talk about three different cases. The first case is the Kohberger case, because with this case, Bryan Kohberger, he is bringing up his defense is throwing out there, what if he has autism, to try to remove the death penalty from his case because he's currently on trial in Idaho. Yes. And they do not have mental health as a defense, but his defense is attempting to get the DP off of the table. And I have some thoughts. And there have been some other cases where people have seen a defendant and they've seen their lack of emotional expression, and people have wondered, could they be on the autism spectrum? And I really want to break this down. And I agree, Sarah. I think the defense is trying. I don't see at this stage, I don't see this trial judge removing it. And I have a link to the because on Crime Fix, they had a lawyer talk about this, and it sounds like Kurt might have talked about this as well, because what they're trying to use is saying that there's an intellectual capacity issue, and that has only been raised with individuals with intellectual disabilities, what we used to call mental retardation, but that language changed to intellectual disability. So somebody with an IQ and they also, because it can't just be a low IQ, it's a low IQ and low adaptive functioning. I do not believe that he has a low IQ. And in order to get into college overall, you're generally going to have at the upper end of low average range to high average, above average intelligence for college. I do not believe that his IQ, but they might be trying to have a new designation for developmental disorders, because autism spectrum disorder is generally considered within that developmental disorder category. And so I think they're trying to throw some things out there. I don't know if he would even meet criteria for the diagnosis either. And and so we'll just go on ahead and break and jump into some of the differences between psychopathy or antisocial personality disorder traits and autism spectrum disorders, because something that both can have is this lack of empathy, difficulty putting yourself in somebody else's shoes, difficulty seeing things from somebody else's perspective. With psychopathy, it's a lack of caring about that, about like how your behaviors impact other people. And with antisocial personality disorder or psychopathy, there's also this manipulation and exploitation that you don't see with autism. Honestly, with a lot of the people that I work with on the spectrum, they are at a higher risk to be exploited by others, because sometimes the people that I've worked with, in their mind, they might view people as good, or they don't view that, like, oh, this person might just be your friend because you give them a ride to work, but they're not really a true friend. And so with autism spectrum, there's this difficulty understanding social relationships. And it does sound like Bryan Kohberger, he might have had difficulty, he might have had this social awkwardness, he might have had this difficulty connecting with women, but it seems like he was creepy almost. Like I don't know that it automatically fits autism spectrum. And with autism spectrum, it's this lack of understanding that, like, oh, if I find somebody attractive, I can't just stare at them. That, like, staring at somebody, they will find that they'll find that weird. With him, it sounds like he was trying to approach the prettiest girls, like the absolute and I don't wanna put it, but, like, I don't know how else to say it, but it seems like he was, uh, like, he thought he was all that, and he would try to approach women that would then be, like, creeped out by him. That's my understanding. And, often I agree that, I meant this one, that low emotional intelligence doesn't always mean autism. And, um this is a great question. Do antisocial and oppositional defiant disorders, does that go hand in hand? So this is a bit of a spectrum. Antisocial personality is a personality disorder, and that's typically diagnosed in adulthood. Sometimes in children, we see difficulty conforming to rules. And so in the past, we saw oppositional defiant disorder, conduct disorder, antisocial personality disorder. We kind of thought that that was the trajectory that some people could be on. Now, just because somebody has oppositional defiant disorder doesn't mean that they were going to start breaking laws and become extremely aggressive and then develop conduct disorder. But typically, individuals that developed antisocial personality disorder, when you looked back at their childhood, they likely met criteria for oppositional defiant disorder, conduct disorder, and then antisocial personality disorder. So just because someone has oppositional defiant disorder, that doesn't mean that they're going to develop into all these other things. And you all know I'm not a huge fan of the oppositional defiant disorder diagnosis because parenting and helping that child understand that you can't always get your way, helping them regulate their emotions, that there are treatments. So there is no medication for oppositional defiant disorder. It's there is behavior therapy, play therapy, parent-child interaction therapy, PCIT. There are all these other things that we get to do. All right. Question. Do autistic people treat women different than, and so I don't think he has, I don't know, so I have not assessed him. Um I so just speaking in general, um because that's a kind of a vague question, and we have to remember that autism is this huge spectrum. Because there are some people that just have misogynistic beliefs based on how they're raised within their culture, within their religion, within their home, within their school environment, or it could be a narcissism that like that men are better than women, and it's part of their, it's part of like a narcissistic belief that a person has. And but like I said, autism is a huge spectrum, and so I can't answer a general question like that because it really depends on the individual. The people that I work with on the spectrum, um often they have miscommunications or misunderstandings with people. They often have no filter. So if a friend asks, "Hey, do you like my outfit?" And if they don't like it, they're gonna be like, "No," and then not understand because that friend might get offended, and then there could be issues down the road. And but there's often these misunderstandings versus with antisocial personality disorder or with psychopathy. There is this sadistic, there's this using people, there's this trying to get over on people that you don't see when someone just has autism. Now, can someone meet criteria for autism and antisocial personality disorder? Yes. So a person can have both. Or I've also seen cases where an individual on the spectrum, to me, because it was back with the, y'all know her name, Gypsy Rose case. The guy, in my opinion, Gypsy manipulated this guy with autism who kind of, I think he had some fantasies of harming people. And then I think he wanted to save her. If he hadn't met her, I don't know if he would have ever done a crime, like, but he thought she was in this horrific experience with her mom, and to save her and be with her, yes, Nicholas. And I don't know if he ever got a new trial. I know that he was filing for a new trial. That Nicholas, to me, he was manipulated by Gypsy in my personal thoughts and opinion. Now, I think he had some fantasies of like of harm. And so if there's somebody that is harming animals, so these are red flags. If they are harming people, if they have this excessive anger that they can't manage, if a girl won't give them their phone number, if they start stalking them. So I have worked with some clients that are on the autism spectrum that didn't understand that, like, hey, if somebody gives you their number, just call them once or twice, but like don't call them 50 times. Because they'd be really excited, like, oh, this person gave me their number. I really want to talk to them. And so it could become almost this obsession. And so sometimes we had to work on that. And it was nothing, their intent wasn't malicious. It was just they didn't understand, oh, this other person is gonna be they're not gonna appreciate, like, you're gonna get blocked if you call somebody 20 times after they give you their number. Or also understanding, consent and boundaries. I did a video recently talking about, talking with people about, the birds and the bees, and especially with children, and especially people on the autism spectrum, because so that they understand it for their own body, so they to make sure that they are not harmed, and then also to understand it for somebody else. That just because you like somebody doesn't mean that you can touch their hair, or that you can give them a hug just because you like them. And so, yes. All right. I hope that's helpful. I Yes, Nicholas Godejohn, exactly. He didn't get a new trial, so sad. Because I did think that he did likely have significant autism. Now he was gonna do some time, but I think he's serving life without the possibility of parole, and wow. All right. And I'm sure his team might continue to appeal to see if maybe he could be resentenced, but that was just an incredibly sad case. Incredibly sad case. And I do think it was pretty violent and vicious. So what he did to Gypsy's mom was horrific and bad. Okay. All right. So, any other questions with autism and psychopathy, or autism and antisocial personality disorder? Just to recap, a person, in my experience, often individuals on the autism spectrum, you're not going to see this manipulation. Now, you might see like they might try to befriend somebody that has their favorite game or something, but it's not on that psychopathic type level. I believe his defense is also trying to restrict the prosecution's ability to say sociopath and psychopath in opening, closing, during the trial. They do not want that language used, but I think they're just trying to, because I think the prosecution could make a case that he was, excuse me, that he was stalking, that he had this pattern of behavior that was problematic, and that he had this lack of consideration for how other people felt. I could see some of those things coming up. All right. All right. I In this case, I I would love to hear the defense experts, because I believe he's met with neuropsychologists that have, I get he might have received some diagnosis from a neuropsychologist. I also think he's very smart, and I think he could have researched what you need to say and do in order to get a diagnosis that he wants. I'm not saying he did that, but I'm just saying, like, it is possible to look up the symptoms, to look up what you need to fit those things. Um, have you watched my video? Because I did a video on the Menendez brothers. Did you already watch that one? Let me know in the chat if you've already watched that video. Uh, and I think they had a press conference. I haven't watched it yet. I have not watched it. Let me know when they get resentenced because, if they do, because California was possibly looking at having them have the option for parole, and so if y'all hear anything with that, please let me know. There is a question, do I think Nick Godejohn should have been in a psych hospital? So he was found guilty, and he was not found not guilty by reason of insanity. I do think he understood that what he did was wrong, and that is our how somebody makes it to an insanity defense is they have to not understand that things were right or wrong. Now, do I think he should be receiving some treatment? He's likely receiving medication if he's open to it. If he wants medication, if he's open to it, he's likely able to receive medication. And there are prison therapists that often individuals can receive therapy because I can imagine if he found out that Gypsy got out and Gypsy remarried and she has a baby, because I think he saw a life with her and he wanted to be with her. I could see that causing him some emotional issues. So I do hope that he has access to therapy, but this is the system that we have. All right. All right. There was another case that I wanted to talk about. It is Ellen Gilland, and this one was labeled a mercy unaliving. She she killed her husband, and he was terminally ill at his hospital. Um, The judge, she, pled no contest. That's my understanding. She pled no contest to the charges, and she describes what happened. We are not going to listen to all of this, but I did want to play a portion of her describing, um, that her husband was terminally ill and he was having thoughts of unaliving himself, and that, he was in a bunch of pain, and they agreed that she would do this and then she would uh, die herself. Now, she survived. The police came in, I believe it was about 6 officers. There is body cam of this one. There's body camera footage of this one, and I'm not going to play it. The police were able to talk her down. It was in a hospital. Like she's in the like there are hospital rooms right next door. Like it's like a middle hospital room. And I don't know if they evacuated those areas. You could kind of see that people were you could kind of see in the background that it did look like other people were there, but the police had secured that area. Um uh and Um, so by the time he was terminally ill and made these reports, I don't think she told anyone that he was having those kinds of thoughts because I think the hospital could have talked about a care plan. And that came up during the sentencing and during trial, I think, is that there were care plans available if they wanted to move him from the unit he was on to something that would be more about, like, giving him care and letting him pass, that there were some other options. And then, in Oregon, they do have, death with dignity laws. It sounds like she was upset that some people didn't explain some of this to her. And now this is her perspective after the incident has happened and all of that. So I'm just going to play a little bit of this.
For us and made and sold wooden boxes. We were married in 1969 when he returned from Vietnam. We were married for 53 years, and I miss him and will continue to miss him for the rest of my life. We did not have children since I had cancer at an early age, which returned late in life. I was diagnosed with the BRCA1 gene mutation, so I had a hysterectomy. My grandmother and my father had osteoporosis, which I inherited. I injured my spine when I was about 5 years old and continued to break bones periodically throughout my life.
And this is at sentencing, and I believe she's making this statement before she's being sentenced.
I have had a dozen hospital stays with broken bones. I have a replaced left hip, replaced right knee, metal rods in both my femurs, and a pin in my right hip. My left knee is bone on bone and very painful. I am able to walk without my walker, but use it most of the time when I have some distance to walk or I'm going someplace unfamiliar. I also use it to keep from tripping over things like an uneven sidewalk. I have type 2 diabetes, high cholesterol, acid reflux, sleep apnea, COPD, and Sjogren's syndrome. Since the hurricanes of 2022, in which our house flooded, I have had anxiety and panic attacks. I have hearing loss in both ears and wear hearing aids. I contracted COVID this past August and have repercussions of increased shortness of breath, exhaustion, and recurring dry cough. As an adult, I was diagnosed with an auditory processing deficit and dyscalculia. I have always known that my learning style was very different than other students. When I was in school, students with disabilities were not recognized. Fortunately, I realized on my own early that I had to take copious notes of lectures, read the chapters, and pay attention to learn. The diagnosis answered many of my questions about myself. I have lived in Central Florida all my life. Jerry and I bought our first home in Orlando shortly after.
I'm going to skip forward a little bit because she's giving the background to the point where he was in the hospital. All right.
Jerry had always been relatively healthy until after he retired. He gained a lot of weight and developed type 2 diabetes and AFib. He had a hernia operation during which the doctors discovered an aortic aneurysm. He had surgery to repair that, but also had another smaller aneurysm closer to his heart. At that time, he had a bad reaction to the pain medication they gave him. At the rehabilitation hospital, I informed them to be very careful of what they gave him. And I never said that he could not have pain medication. I watched my mother, brother, and both sisters die of painful and debilitating diseases. I thought I was ready for anything, but not the painful and debilitating death of the person I loved more than anything in my life.
And the reason why, so you'll know when I talk about cases, there's always a reason why we are talking about it. And the thing that I wanted to talk about is that there is something called comfort care. And it sounds like he had a trachea, like he had like a breathing tube. And it sounds like she didn't feel there was great communication with the hospital. We're going to get to that in just a moment. She's going to talk about how she hired nursing staff to be there overnight because she would get there the next day and there would be issues and she wasn't notified that there were issues. So she wasn't happy with the care that he was receiving where he was at. But and then also somebody having I think either the DNR, the do not resuscitate, or like an advanced care plan where somebody talks about, okay, if if these things are happening, this is what I want. They're little pieces of mustard, but not like the yellow mustard one that I've had on before. All right, I'm gonna stay focused. Okay, so let's keep listening to this part.
Jerry's brother Sam.
Okay, I'm gonna skip that part because once again, like I said, she wasn't happy with the communication that she was having with at the hospital.
Bordering on the hysterical, and it was difficult to communicate appropriately when doctors and nurses ignored me or were outwardly hostile. Both Jerry and I were optimistic when he was transferred. He was doing better, even though he had a very painful bed sore. He could talk some, even with the tracheotomy apparatus in his throat, and he could consume soft food. The physical therapy department came in every few days and got him up and standing beside his bed. About 3 weeks went by, and we were expecting the tracheotomy to be removed soon. But the nurses kept giving him food and then taking it away because they said he was aspirating it. As days went by, he became more depressed and very weak. Physical therapy stopped coming in every few days and then stopped coming at all, since he couldn't even stand even with help. I stayed at the hospital for 12 to 14 hours a day. The only time I left his side was to go downstairs for food or a cup of coffee. I felt I needed to stay with him because the nurses were being uncooperative and uncommunicative. An example happened after his first.
And if somebody is having this level of difficult, and I think she's going to say she talked to the patient advocate. She's going to say all the things that she did. But what you can't do is you can't bring a loaded pew pew and do that to the patient and then plan to also you just can't do that because that's what happened. And it's my understanding, and we are going to play a little bit of the police officers, one of the 6 police officers that responded after after the shot for the husband, because she pointed the weapon at them, and that's where I wonder if she was trying to have the cops do it and if she didn't want to do that herself. If anybody is struggling with any of those types of thoughts, I always keep resources down in the description. This is very difficult because now she's going to be in prison for and the judge is giving her a reduced sentence. They didn't do the full trial. She pled no contest. And but the judge made sure, because her actions impacted and possibly traumatized the medical staff, the police officers that responded, and all of this. So yeah.
First night in the rehab unit. I told the nurse as I left that if anything happened during the night to please call me and I would come back. I walked into his room at 7 a.m. the next morning to see him strapped to the bed with mucus all over his chest and face. He had a suction device to clean up the mucus as he coughed it up, but couldn't use it with his hands tied to the bed. I untied him and cleaned him up. The nurse said that he was pulling his leads off his chest, and this was procedure. I told her again that I would have come back and helped, but these kinds of things continued. I hired an outside nurse to come in and sit with him at night. After several weeks, I found out that the paid nurses were sleeping through the night, and no one at the hospital thought it was their job to tell me.
but that's where, like, if he was okay and it was the middle of the night, often they would kind of close their eyes, but I guess she wanted somebody, like, standing over him, watching him all all night. So I had a family member that was in the ICU. I've talked about it here before. I stayed with them overnight and I did try to sleep a little, and I would wake up because if they needed something, if something didn't sound right, I would wake up, but I did not just watch them the because once everything was okay, I did, like, try to get some sleep. Um, but yeah. Mm.
I then spoke to a patient advocate at the hospital, and she arranged to have a cot brought into the room. I located another nursing company and arranged to have different nurses there at night so I could get some sleep. They were to wake me if anything happened. I continued to eat downstairs since I didn't want to have food in the room when Jerry couldn't eat. I bought a coffee maker so I wouldn't have to leave for that. Jerry continued to deteriorate to where he could hardly lift his right arm. When he could talk, he would tell Sam that he wouldn't make it out of the hospital.
The video paused, just in case you're watching. The video paused, and I think it'll resume at some point. But we can hear it, but if you've noticed her lips aren't moving, something happened with the feed.
He spoke of ending his life. 2 days before his death, the doctor came in and said it would be at least 3 more weeks before they can consider removing the tracheotomy tube.
All right. And so, because she's then gonna talk about that she typed his note on on their home computer, that she talked with him about it. This is what he wanted, and now that tracheotomy tube is no fun. I've mentioned before, I had a family member that had they were on a respirator. So I don't know if that tube is different, but it's not. It is no fun. Um, but I wonder if they could have talked about, okay, he's asking this to be removed. He would like comfort care. What are the options? He is refusing this continued treatment, or so I wonder if there was a conversation, but then I think they also didn't want things to be painful, but I think they could have had a conversation. They often have social workers, they have medical social workers in hospitals that sometimes come and talk to the patient, that talk to the family, and then they're able to kind of go through everything. And then sometimes the medical team then comes up with a plan for what they do to move forward. And she's saying that he could, and that's where I don't know. I don't know. Um, but I want to skip ahead to the officer. So y'all know I keep the links to everything down in the description. This video has the actual body cam footage of all 6 officers with shields and weapons drawn on the room. And so that's where I'm saying, like, you could tell, like, this is a busy hospital. Let me make myself so just so that, because I'm not going to play the video, but I'm just gonna you can kind of see the screenshots in the previews, I believe. But this is a hospital room. This is and and that's what happened on that day. And one of the officers is gonna describe her pointing the weapon at him, and I just wanted to play that part.
Sergeant, when you first entered the room, can you describe to the courtroom what you saw?
When I first entered the room, I saw the bed with the man laying there, and then saw Mrs. Gilland on the other side holding the black revolver right towards me.
All right, when you say right towards you, was she pointing the barrel towards you?
Yes, the girl was right towards me.
And so that's where with that situation happening that way, and he's going to explain that he felt they were afraid to fire into the room and cause a bigger, because there are things that are flammable. There are things that could cause an issue, and so, they wanted to see if they could talk her down, and they were, 'cause she was able to be safely, arrested and apprehended. I think she spent 40 something days in jail, and then she was out on bond, and, the judge did sentence her, and so I wanted to play a little bit of the sentencing. Y'all know full links down in the description. So let's play the sentencing. I'll make myself small again and hear from the judge.
Um, so to kind of reiterate, Ms. Gilland, you're here on the counts that your attorney stated. You've got the one count of assisting self-murder or manslaughter, 2 counts of aggravated assault with a firearm, and those refer to Mr. Jackson, the security officer, and Mr. Aponte, both of whom testified here today. And then you have that 4th count of aggravated assault on a law enforcement officer with a firearm. And there were 6 officers who were named as victims in count 4 of the indictment. So the score on the criminal punishment score sheet is 115 months, which would be 9 years, and roughly 8 months. The state, as you know, has agreed to waive the minimum guidelines.
And in this case, I think the state felt sorry for her. So she is currently 78 years old, and she was sentenced to a year in jail with 12 years of probation, and she has to get a mental health evaluation. She has and follow all recommendations. She has to do community service. I think the judge said 8 hours a week of community service, and the judge, what they were sentencing her on was for the things she did to the other people. And, and once again, super duper sad case. Um, I think the fact that they didn't go to trial, because I think if she had went to trial, she was probably going to be found guilty and likely die in jail. And so it sounds like they were able the prosecution agreed to, because there is like a minimum sentence, and they agreed for the judge to go lower than the minimum sentence. Super duper sad. I wanted to talk about that one. And now we're gonna get to a case that involves a child death. So I know for some people that is a understandably sensitive topic. If that is, feel free to head out. If you want to continue with us, we are going to talk about the case of it is, y'all know me and names, Jermaine Bass. Okay, let me share my screen, make myself small. All right. Super duper sad case. Okay. Super duper sad case. Before we go to this, I want to answer this question. Was it truly a mercy? We only have her word. We don't have, because it doesn't sound like her husband ever told the medical staff, or from my understanding of everything, it doesn't sound like he ever told the staff how he was feeling. And I wonder if they wanted to go out together. I I wonder about that. Um my heart breaks for the families and all of that. Um um and he had a trach. I don't know if it was the I don't know, because sometimes they have the trach just to keep the airway open. I do not know what was going on with all of that, but yes. And Future mentioned he might have had a speaking valve with the case. All right. So let's move on to the next case. I've already given my trigger warnings. All right. So this is the case of Jermaine Bass. This is a case out of Tampa, Florida. Um, he was charged with murdering his 5-year-old daughter and attempted murder of his 8-year-old son, who was shot in the head and has significant um, uh, processing, verbal, I think auditory and verbal processing issues, and then also has he lost hearing in a ear. One of his hands. So this child had significant. Um, the child survived and has significant mental health, medical things moving forward. Okay. This incident happened in August of 2022 at their home in North Tampa. What the defense tried to claim is that it was an accident, but the weapon fired 5 times. So he tried to say it was an accident, and the jury did not buy that at all because he was found guilty after a 4-day trial. I think the jury deliberated, if I'm remembering this case correctly, because I was watching the verdict watch with this one. I want to say it might have been like 7 hours. I'm not sure. But the 5-year-old did not survive. And the son was in critical condition, including was in a coma, and he still has one of the bullets in his head, because they were not able to do surgery to remove it. Okay, super duper sad case. This incident happened after his wife Shirley had come back. So the wife Shirley went to her sister's birthday dinner at Ruth Chris, and the father and children stayed home. It sounds like it was just an because it sounds like it was an adult, just some of the adults getting together to just have dinner. And the former wife, Shirley Bass, she did not testify in this case. They did play the audio of her. They did play the audio of her 911 call, and the 911 call was, to say, emotional. Like, you and the 911 operator attempted to get her to calm down, but she likely just witnessed or heard or saw her husband unalive one child and significantly wound the other. And so she was just screaming, crying, yelling. And I'm not going to play that video. If you want to hear it, it's on Law and Crime, it's on Court TV. Very, very emotional. I tried to listen to it, and I could not make out what she was saying. And I think that was a normal reaction to this abnormal situation, completely abnormal situation. And so the parents were together at the time, and we are going to ruin the good, because the one of the cousins, no, so wait a minute. So some family members that were at the dinner talked about that Shirley seemed fine that day. Like, there didn't seem to be any major issues going on. Now, on the drive home, because Jermaine, the husband, he ends up, like, following her car back to the house and following kind of closely. And um her niece that's about 6 years younger than Shirley, she did testify. I have that link down in the description as well. But she testified that he was upset that Shirley wasn't driving the car, and was like, but it was weird. So it sounds like there was a weird interaction between the two of them on the way home. She kissed the kids goodnight, and then because this happened around 10:30 at night, and that's what happened. I do think there might be pieces to the story that are missing, and the reason why I wanted to talk about this is because I was wondering if she wasn't in a mental and emotional state to get in front of him and testify. Uh, uh, the one child survived, and the child that survived has the exact same name as dad, and they had to explain that to the jury. Um, I think it's a junior because they call him JJ. And so in the jury instructions, they said, okay, like where we're talking about JJ, that's who this is. And then when we have this full name, that's the defendant. Like my heart breaks for them. And the prosecution could have subpoenaed her and threatened like contempt, or like the prosecution could have really tried to push to get her there, but I wonder if they knew that she wasn't gonna be in an emotional state to handle it on the stand, from both the state side and also from the defense cross-examining her. But the defense didn't call her either. So she did not testify in this case. The state talked about the fact that yes, the jury did not hear from her, and the prosecution talked about it as well. So I don't know, this the prosecution and the defense both mentioned that she didn't testify. Um, um, and then I didn't think about that point, that there might be some things that she might not be able to testify, but I think if she witnessed it, I think anything she heard, I don't know, I could be wrong. Remember, I'm not a lawyer. So they were legally married at the time, so there might have been some type of spousal privilege, but he was trying to say that it was an accident. And I do respect the fact that both sides seemed to show respect for the fact that she wasn't there. But she did have family members. So she had a sister and her niece, or no, I think it was sister in law. Her sister in law testified in court, and then also her niece testified about that day at Ruth Chris, and then the family found out the following morning what had happened. They also showed body cam. I didn't watch that body cam, but they showed body cam at the hospital of her after she had been notified that her daughter did not make it. And it's my understanding that was understandably emotional. And when talking about these types of cases, um, I just I wonder if there was something going on, and he completely emptied the weapon. So when the police got the weapon, there were no more rounds in it, and it reminds me of the guy that um oh my gosh, I know the case because he tried to, I think, plead not guilty by reason of insanity, but he shot the kids outside, and, like, mom was there and heard it. Y'all know that case. Uh, I'm gonna look it up. Oh my gosh. Uh, I'm see if the chat already found it. I'm so bad with names because we had the body cam footage after that incident. I did. I totally I forgot his name. But like, and that's where, but why take it out on your children? Yes, it was probably Chris. Was it Chris? Let me see. Let me see. Let me see if that helps. Watts. Chris Watts. Yes. Yes, yes, yes. That was the one. Thank you. See, I told y'all. Y'all are always the best. Dorman. There was also Dorman. My bad. Dorman. It wasn't Watts. It was Dorman. It was Chad. Was it Chris or Chad? I'm bad with names. Chad. That one was Chad Dorman. But I think there was a Chris Watts. I wish these things didn't happen. Okay? So don't do crimes. I wish those things didn't happen. But the Chad Dorman was the one that I was thinking about. All right. Super duper sad. Super duper sad. But with this case, he was found guilty of, let me pull that back up because I have another one. He was found guilty of 2 counts of aggravated child harm, and first degree, capital M, and then also attempted, capital M, for the 8-year-old. And both children were shot in the head. And because my thing also, let's say a weapon did accidentally discharge, why do you have it in their room? Like that would be weird to me. There was a neighbor that heard the 4 to 5 shots. He was a college football player at the time. He testified during the trial. I thought, and he was the mother used his phone to call 911. So I think mom was so upset by everything, she actually ran out the house, and the neighbor heard what happened, and then he saw her outside of, because these were like townhouses. He saw her outside of his door, and he used his phone to call 911. Like, and I think the defense was just trying to have a defense, and I think he told the police that it was an accident. So I think they were trying to go with what he had already said, because right after it happened, that's what he said. He said it was an accident. So he didn't say I didn't do it. Like, he didn't say she did. Like, he said it that he did it and it was an accident. Super super sad case. um But with the surviving child's recovery, I often think about survivor's guilt, because he likely loved his sister. So the prosecution would ask questions for the people that knew both children. They would ask, like how were they together? Did they play together? Just in case the defense tried to say that, like, one of the children, like, I think they were just trying to prepare to keep it out the jury's mind. Like, the children did not do this to each other or to themselves, or anything like that. Like, this was, um, unfortunately, what their dad did. And I'm thinking he's probably going to face life in prison, because this happened in Florida. He'll have in Florida, they have that added penalty. Like, when you use a pew pew in a crime, they have extra penalty for that. And just super super sad, super duper sad. So I'm going to keep an eye on sentencing for that one. I do think he'll likely get life, possibly life without the possibility of parole. um and so it's my understanding he did it after she came home. So she came home, gave the kids a kiss goodnight, and we do not know. To me, there are things missing. So what happened? Like, did or like was he? And it wasn't like she went out with like a man, or like there wasn't infidelity. There wasn't any, like, she went to her sister's birthday dinner. And the sister, where this was her birthday, this is also gonna be the and like, it's gonna be her niece's death day as well. And that can add additional trauma, that can add additional pain to a family. And so my heart really does go out to the family. I hope the child that's continuing to recover, that um, that he's able to know it wasn't his fault. He didn't do anything wrong. Uh, the place that he should have felt safest wasn't. And they didn't really bring up, like, was there any, like, where was there TV in the home? Like, there was no accusation of any of those things. And I think that's where the defense was just trying to say, "Oh, it was just an accident." But that's where I wonder what else was going on and what are we missing from the rest of this story. Super duper sad. Um, I saw this, Ordinary People, Amazing Story of Survivor's Guilt. Yes. Thank you for mentioning this. All right. All right. Let me know if y'all have any other general questions. I am gonna go have lunch, a late lunch with a friend. I hope y'all enjoy your Saturday. The weather is beautiful here in Virginia today. It's gonna be winter again tomorrow, so we have false spring. Today it's like 60. It's like it's really nice. It's really really nice outside. Tomorrow the lows in the 20s, highs in the 40s. And so we're going to get winter again tomorrow. And so Virginia, the weather is going to be doing a whole bunch of this. And so we have we've had like a few days of spring and then we're going to go back to winter for a little bit. Virginia, you never know, you could get snow in a few weeks. We'll see. But um I agree. I definitely think that we are missing some pieces. I hope y'all take care of yourselves. Drink your water, do your self-care. There's a lot going on in the world. If you haven't checked out my book, Turning Crisis into Clarity: How to Survive or Thrive in the Midst of Uncertainty, um, I wrote it back during 2020, but all of the information in here applies if the current times are bringing up anxiety, stress, and the thing that I ground myself on is, I ground myself in is, what can I control? What can I do? What's in my power? And then I also have a very very dark sense of humor, and so there are some TikTok songs that are stuck in my head, and I'm having fun with that. But I hope y'all enjoy the rest of your day. Thank y'all for being here with me. Have a good one. Bye.